Good afternoon, everybody. Thank you so much for spending your time with us online at Unison. We are very, very excited to welcome today Sally Okasha. She is the project lead with Community Connect YYC, very important organization. I'm not going to do her a disservice. I'm going to let her introduce herself. But if everybody online could join me in welcoming her with a big virtual clap. Welcome, Sally.
Thanks so much, Sarah. Thank you. I'm so happy to be here today. And yeah, I'm just going to talk to you today about Community Connect YYC. So just to clarify, I am project lead for this collaborative or initiative. Uh, but I actually work for Kindred, which is a non-for-profit here in Calgary. And we do a number of different community services and programming. But counseling is a big one of them, and I'll talk a bit more about that. But Community Connect YYC is a collaborative which Kindred leads, but it's also with 14 other partners. And the whole point of this is that it is a one-stop shop to counseling. So a lot of the times people are struggling with finding resources, especially mental health resources, that don't have a long wait list and are affordable. And Community Connect YYC was launched or founded to address both of these problems. So we launched back in August of 2020, and we started out with just a few organizations, and today we're at 14 partner organizations, and each one has sort of their niche of what kind of counseling they provide. But we do provide counseling for all age groups and different kind of concerns. So the idea is that you're able to go on there and pick something that is a good fit for you, regardless of what you may be going through. So I thought I'd go over like a little bit about what CCYYC, that's the acronym for Community Connect YYC, is all about. And then maybe we could do a website tour and show you how you can access the services.
Excellent.
So I'm just going to share my screen here, if that's okay. Um, Sorry, just bear with me.
And just while Sally is setting this up, I just want to say to anybody in the audience there, if you have any questions or anything you want to ask or statements, go ahead and type it in the chat box. I'm monitoring the chat box, so we'll be able to touch base on it either, as soon as possible or definitely at the end.
Be able to see my presentation here?
Yes.
Okay,
Yes, we
awesome.
are.
So perfect. So yeah, I'm just gonna go through some of information about Community Connect and our partnerships. So one of the partners that we do have is what we call inventory partners, and these are the partners that provide counseling slots onto the website, onto Community Connect YYC. And I'll show you shortly what that looks like. So just some of our partners, we've got Trellis, Center for Newcomers, Vicova, Canadian Center for Men and Families, YW, and a number of other ones. And like I said, each one has sort of their niche of type of counseling or population group that they serve. But it's all meant to be affordable and timely counseling. We also have another kind of set of partnerships, which we call external referral partners. And these are partners that we work with in the community that can refer directly to our services, sort of to eliminate that barrier for clients. So with Unison, for example, like staff at Unison can directly refer to our services without the client having to go in there and do that. While at the same time protecting your confidentiality and privacy because the staff worker doesn't get any information after the fact about whether or not you've attended the session or anything like that. So it just helps with getting you landed in that service and making it a little bit easier.
Yeah, it's that bridge to connectivity.
Exactly. Yeah. And I know a lot of times it's frustrating with all the different resources out there, you're given different numbers and you're having to call around. And I know that does cause a lot of distress for people because they don't know who to call. And it can be very overwhelming. So this is meant to eliminate that step, hopefully.
Absolutely. It's so funny because today I was in a meeting and we were just talking about how, some people, older adults or I mean even younger adults or they don't necessarily know where to reach out, but that it just creates an extra barrier and they just think, oh, I'm fine. No, I don't need it. I'll just handle it on my own. So that's definitely something too that I think a staff member, if you see somebody weekly, bi-weekly, monthly, you would know if something's up, right?
Yeah. And then that way as well, there's also like, I feel like the fact that there are so many resources, but which one do you choose? Which one is right for you can also be overwhelming. So it's like, I don't know who to call, but then there's all these numbers that I need to call. So it's like, yeah, it's hard to
Absolutely.
balance that out. Yeah. Um, and so uh, our technology partners, so the website that helps us with the booking is called CareDove. So it's very big on confidentiality and privacy. It deletes client information after 60 days, so that that layer of protection is we've got that extra layer of protection when it comes to client confidentiality and privacy. And then one of our funders. One of our biggest funders is the city of Calgary. So we have a few partnerships with our partners on Community Connect YYC where we've gotten funding through different streams, but all through City of Calgary. And just some interesting facts that are helpful to know. 28% of clients book during after hours. So these would be from 6 p.m. to 8 a.m. So those are usually the times when offices are not open and there's nobody really, unless it's like a crisis line, there is an intake that you can call into and book. So this is meant to target that need of sometimes people are going through you know, going through things during times where they're unable to really call somebody and book something. But this allows them to go into the website and book any time of day, regardless of whether offices are open or not. And then there's a 2-day average from booking from when the client books to when they're seen. And that's also another important piece of information because we know that, again, wait lists are a big problem when it comes to mental health and counseling. So 2-day average is great. I know that for Kindred's rapid access counseling, a lot of the times you can find sessions the next day or even the day of, which is unheard of in the counseling world. So I do invite, you or if you know somebody who's wanting that immediate support, we do provide that.
That's phenomenal because you're right. It's in those moments when people aren't in the office, when you have a moment of panic and then you wake up tomorrow and think, oh, I'm okay. Or, oh, it was just a bad night so it is really great. I think that's very important.
Exactly. And then also just the piece of having to really speak to somebody. Like I know that sometimes people don't want to talk on the phone and disclose things. And this kind of gives them autonomy and allows more for privacy so that they're not sharing with somebody over the phone. They're just able to book in and see the counselor the day of the booking. So that's also another advantage of this.
Absolutely.
So I thought we could do a quick website tour, just to show you what it looks like from your perspective if you were to go in and want to either book for yourself or a loved one or somebody you're supporting. So I'll quickly, sorry about that, share my screen again. Yeah, are you able to see Community Connect, the website?
Now we are, yes.
Okay, perfect. So this is our homepage. This is just, some information about what Community Connect is all about. Some of those stats that we talked about. We're very proud to say that we have 18,000 plus appointments booked since launch.
Wow.
So it's it's something that's been just growing since we've launched it in August of 2020. And of course, with the pandemic, there was a massive need for this. Still is, but I feel like things have settled a little bit since then. And then for the purpose of like, if you want to go and book and you want to find some options, you'd go to our services. And then we've kind of divided up the services into population groups or what we like to call buckets. So we've got individuals, adults, individuals, families and couples, children 12 and under, teens 13 plus. We've got some specialty services, and then we have a bucket for group and peer support because we have quite a lot of groups on here through different partners. So that's like where you would want to go if you wanted to book. Another way you can find services if you're looking for a particular service through a specific organization, you can go to partners and then you'll see all of our partners here. And if you're interested in booking specifically, for example, with Vekova, you can click on that and that will take you to a page that has Vekova service on there. But I would assume most people would want to go to our services and filter through the different buckets or population groups. Um, so just to take an example here, I'm going to try to go to adults. So let's say you're wanting, counseling for yourself and you're an adult. So we've got a number of services here and they all have a bit of an explanation of what they are, what the costs are, who they serve, and what languages they're available in. So if we wanted to just take Kindred as an example, I'm going to click on that. This will take you to a page with more information about what the service is, just so you're kind of informed about it before you book in. And I'm going to click book service. And this takes me to the booking page. And then, our address is here, but we do offer both virtual and in person. And then as somebody that you're booking, languages available here are English, Arabic, and Swahili. Those are spoken on different people on the team. So to book an appointment, you're going to click book appointment. It asks you for an address. You can put any address. This is just to make sure that we're not getting people booking in from outside of Alberta because we're not able to provide services to anyone. So I'm just going to put Kindred's address here. It's just for the sake of the demonstration. So as you can see, it populates all the appointments we have as early as tomorrow morning, which is really convenient. So let's say we wanted to book for Monday, February 9th at 9:30. If I click on that, it will tell me the date, the name of the provider, and then whether it's on Zoom or on site. And you can choose that. Some of them are you're just given one option, which is Zoom. Some of them you can choose between them. So you might have to just play around with it to see which one is a good fit for you. So you're going to click on preferred language, appointment type. So we see everybody, individuals, families with children, couples. We also just see kiddos, as long as, we have consent from guardians. And then this is the external referrals that I had mentioned earlier. So, for wanting that, so we can click on, if I'm referring from one of these, then I would click on it. If it's client referring themselves, then they would just say not available or not applicable, I'm self-referring. And then next. So there's only a few mandatory fields here, just to make this as low barrier as possible. You don't need to make an account or anything like that to book. So we just need a name, phone number, so we're able to get in touch with you, and a date of birth because we need to know whether or not there's going to be minors present before a session. And then the only other mandatory field is if we can leave a voicemail or not. Once that's filled out, then you will click finish and you are booked in, and you'll be contacted right away with more information from the therapist, with a Zoom link, with consent forms, whatever it is that that service requires. And it's really that simple. And the whole point, again, is to make it as low barrier as possible.
I love
Uh,
that.
yeah. Any questions that jump out, Sarah, like just from the
Yes,
registration?
I have a few.
Yeah, go ahead.
I was just wondering if there is a cost at all to this, to the person seeking out that service.
That's a really good question. So all of the services on CCYYC are affordable, but they vary in the, let's say, structure, the fee structure. So for Kindred, for example, for this service, rapid access counseling, it's pay what you can. So it's that can range from $0 as the minimum to a maximum of $195 per session. Of course, you know, we do take insurance, so insurance covers, then you're most likely to pay on the higher end, but it's pay what you can. So whatever is manageable and affordable for you at this time. And for those who have kiddos under the age of 18, it's covered by the FRN. So that is actually, there's no fee
No fee
for,
for, okay.
for
So
folks
then
like that.
how do you determine if somebody is able to pay? Because some people say, no, I can't afford it, but really on like they can. So how do you determine?
Yeah, that's a good question. We honestly just take the client's word for it. So if they're saying, I can only give $1 today for the session, we will do that. We don't ask for proof of income. We don't ask for pay stubs or anything like that. I know other services do, other
Yeah.
agencies do. We don't do that at Kindred specifically. Some of the other services on CCYYC are sliding scales, so they might be asking a bit more questions. Like, they might ask what your income is, and based on that, they'll give you like a range. Kindred doesn't do that. So the way you can find out whether what the cost is if you go to, are you able to see the CCYYC back now?
Yes. Well, yeah,
Yeah.
we can see rapid access counseling.
Okay. Yeah, I'm not sure how to. Yeah, sorry. So see where it says like what is the price? That will tell you what the fee structure is. So
Okay.
if we were to go to a different one, so the YW adult individual counseling, for example, um, they do 0 to 120 per session.
Okay,
So
okay.
yeah. Um, so every service is different, but they're all affordable. They're all like some kind of affordable model.
Ah, I love that. And I
Yeah.
really think it's great that Kindred, we take their word for it. I think that's
Yeah.
really, really empowering and that yeah, that just it's not all about everybody, usually it's always based on, your annual income or, that's why I asked what kind of stuff, how do you determine who can pay what?
Yes, exactly. And we also understand that just because you have, am I hello? Can you hear me?
You are frozen, but we can hear you.
Okay, maybe I'll stop sharing. We also understand that even though you might make a certain amount, you may have other things going on that are taking up those expenses. And, that shouldn't be the only factor that we take in to make that judgment. So it's all about client autonomy and just allowing them giving them the control.
Absolutely, yeah. And yeah, I think that's just wonderful. I did have another question. So,
Yeah.
I wondered what is the background of the people offering the therapeutic services? And what kind of conversations is there anything that's kind of, okay, well, I can't discuss that, or like how do you know who's the best one to reach out to for, I mean, what single, individual concern that I have myself. So, I mean, some people are better with, finances, while others are better with emotion, things like that.
Yeah, I think that it kind of depends again on the program. I'll speak to rapid access counseling because I'm really familiar with our team. So we're a very generalist program, so we pretty much deal with any concerns. There isn't like specific specializations because it is a single session, so it is more generalist. Our counselors are either Masters of Social Work, registered psychologist, provisional psychologist, or Canadian certified counselors. So we do have different counselors with different qualifications, but they're all, accredited. They're all qualified. Other services may have different qualifications, different uh, kind of niches. So, for example, like if you're looking for addiction, support with addiction, I would say we've got the Alex as one of our partners. They provide the rapid access addiction medicine. So they provide healthcare services and counseling supports. And they have a wide range of like a big team with nurses and social workers and counselors. And then, for example, if you're looking for like very specialized services for men and men issues and concerns to do with people who identify as men, we've got Canadian Centre for Men and Families. They have psychologists on their team. So it kind of varies on according to the program. Um, but most of them, I would say it's like general concerns.
Oh,
So they would
well,
cover like anxiety, depression, just daily functioning, managing emotions, things like that.
and then what's the length of time that you can see somebody for? Is it just indefinite, like, or until you end it, or how does that work?
So that also depends on the service. Some of them will provide like 8 sessions. Uh, for Kindred, it's a single session. You can come as many times as you want. There's no limit. We have clients who have been coming to us for years, but as long as you understand it is a single session model, so it's very like future focused and it's solution focused. So we just our limitations is as long as you don't book more than once a week and you don't book more than one at a time. So you have to book them one at a time because it's
Okay.
single session. Yeah.
And then typically, how long are the sessions? 1 hour or hour and a half or?
So for rapid access counseling, normally in a therapy world, counseling is 50 minutes. 50 to 60 minutes.
Mhm.
But with rapid access counseling, the reason why you can get that immediate support is because we do intake, consent, all of that during the session. So that's why our sessions are 75 minutes at Kindred
Ah,
specifically. But the other programs might be different. Some of them they have a separate intake. So when you're actually booking with them, you are booking for an intake session and then they book you in for a counseling session. But generally speaking, in the counseling world, it's usually 50 minutes. Like if you
yeah.
were to go to a private practice, it's always going to be 50 minutes, the sessions.
Oh, are you guys funded through the government or like how I realize I'm getting into a little bit of the more uh, work side of things
Yeah,
or organizational, but yeah, it's just something that popped in my mind. I wondered if you guys are funded because I know a big thing, especially like nonprofits and things like that. It's how can one offer a service if there's no income if you're
yeah.
offering it for free, like how are you able to do that?
I think that's super valid question and important to keep in mind uh, when you're working in non-for-profits, that's always something that we need to be considerate of. So Community Connect is funded by the city of Calgary through like a couple of different streams, but it is through the city of Calgary. But we're also able to maintain it throughout all these years through every partner pays a fee that goes into maintaining it, especially to our technology partner, Cared of.
Mm.
They that's how we are able to maintain it so that we're not solely relying on uh, funding, whether that's from the city or otherwise.
Yes, oh, that makes sense completely. I think that that's smart, right? Have a
Yeah,
different avenues so that you can keep this thing, above ground and still breathing and able to have it accessible to people that truly need it. That's the most important thing, right?
absolutely. Yes.
Ah, hmm.
Yeah, and we're trying to kind of spread the word and let people know about the service because I think it's one of those things that's people just not enough people are informed. We know that there's a need for mental health services, but there are barriers, and we've just found that we need to be more well known in the city and in the province because we do actually serve Alberta wide. So anyone in Alberta can access rapid access counseling, at least like our kindred services. So that is something that we're working on, and that's why we were happy to do this presentation and create as much awareness as possible.
Absolutely. You're right. I do think that it's something that is it's not well known that this service is out there, and very, very important, especially related to mental health and well-being. So, and like we talked about earlier, it's tough when you're feeling overwhelmed and or scared or anxious at 7 p.m. and there's nobody to call. And if you don't have family here and you don't have roommates or you don't have friends that you can reach out to who is there. Somebody can feel really alone and isolated there. So it's just I love the whole idea of Community Connect YYC. I think that's why I was so grateful when I met you guys at the Center for Newcomers Expo, I
Yeah,
believe, and I thought,
yeah.
man, what a wonderful service! I have to get them on the podcast or on the presentation, my YouTube page. So I'm so glad that you were able to join me, Sally, and I mean, if there's any questions out there, I asked quite a few. I had a few kind of prompted, ready to go because I wondered for myself, honestly. But if anybody else has any other questions outside of this presentation, do you have some contact information, or maybe you can put up a slide that people can maybe take a picture of or
Yeah,
screenshot so that they
absolutely.
can reach out?
Yeah, just give me 1 second here.
Yeah,
This is going to be on YouTube?
it is. Yes.
Okay, so maybe also like in the description, uh, we can we can have my information there.
Yeah, well,
So,
I mean, I will try. I have to be honest in saying that I'm not the one, I don't have the time to be
oh,
able to
okay.
edit and post it. So
That's
I can
fair.
I can request it, but I can't promise anything.
No, that's so fair. That's so fair. Let me just put the slide up. Second.
And then I usually say, to anybody at this point who's attending or anybody out there in radio and YouTube land, if you guys wanted to reach out to me, my email is Sarah C, Sarah, and then the letter C at unisonalberta.com. So you can reach out to me and I can put you in contact with Sally and or send you anything that you need to be able to be in touch with Community Connect YYC.
Amazing. And this is my email, so feel free to take a photo of this and get in touch with me, whether you're somebody who's looking for services or you're somebody who wants to come on as a partner or learn more about what collaboration can look like with Community Connect YYC.
Absolutely. Or if you have a friend that you think this might be useful information to give to, it's always strength comes in numbers, right? So absolutely. Take a picture, take a screenshot, save that email. Like I said, you can reach out to me anytime. But yeah, I'm so grateful for your time today, Sally. I don't know if there's anything last minute that you wanted to add in before we let you run away here. I know this one was a little bit, it was about 35 minutes, not the complete full hour, but I think that's nice. We just hit you with the facts and got right in, and I really like that. Everybody,
Yeah,
that's what we want. We want our information right now, and we want it quick and easy, and go on about our days. We're all very busy, right? So,
totally.
um,
Yeah. I just want to say thank you so much for having me. I really appreciate that. And yeah, it was a pleasure. And I love like the way this is structured. It's more like a podcast. I think that's great. And it's giving me some ideas.
Oh, great. Well, reach out to me anytime because I would love to have you back if you want to talk about more
Awesome.
stuff. Yeah, I do one online presentation or podcast, if you will, per week. So make sure you come on back next week. You see who else I can get in. I'm going to be talking with um, oh my goodness, it's preventing falls as you age. So we're going to be
Okay.
back talking about that next week. And Sally, anytime, like I said, you want to reach out, we can get you back in and maybe talk about a different aspect or a different area of Community Connect YYC.
Awesome. Thank you so much, Sarah.
Excellent. No problem. Thank you
Okay.
so much for your time. Thank you, everybody who attended and who watched online. I always give out hearts at the end, and I look forward to seeing you guys next week. So come on back on Friday, February 20th, and we will see you guys soon. Take care, everybody. Thanks so much.